Welcome to this video, which explains the Adverse Drug Event and Potential Adverse Drug Event Rates Report and the Adverse Drug Event and Potential Adverse Drug Event Patient Listing Report. These reports are sent to the home health agencies participating in the Coordination of Care initiative led by the Lake Superior Quality Innovation Network. Lake Superior Quality Innovation Network, or Lake Superior QIN, includes Michigan, Minnesota, and Wisconsin. These reports are sent to home health agencies via a secure link each quarter. Sharing these data reports gives your agency another opportunity to review your data. Reviewing data is helpful when looking for opportunities for improvement and benchmarking. This collaborative is focused on reducing hospital readmissions and promoting medication safety across the continuum of care. We'll start with the Adverse Drug Event and Potential Adverse Drug Event Rates Report. Let's start with the definitions on page 1. I'll refer to the adverse drug events as ADEs and the potential adverse drug events as pADEs. The total number of unique screened patients. This is the total number of Medicare fee-for-service beneficiaries screened for adverse drug events. Each person is only counted once. On the OASIS form, this includes rows that have any Medicare equals Y and Medicare HMO equals N under payment source on page A. These are fee-for-service Medicare beneficiaries and does not include any patients on Medicare Advantage. Rows that have a non-missing Y or N value for drug regimen problem found under medication status or OASIS patient tracking sheet data fields M1021 primary diagnosis, M1023 other diagnoses, and M2001 drug regimen review. Next is total number of unique ADEs. Each event is only counted once per the OASIS definition of an adverse drug event. Total number of unique pADEs. This is the total number of potential adverse drug events. Each event counted once per the OASIS definition of a pADE. The total number of unique screened high-risk patients. This is the total number of Medicare fee-for-service beneficiaries taking 5 or more medications. This includes rows that have 5 or more medication equals Y under hospitalization risks and with diagnoses of cardiac or peripheral vascular disease, chronic pain, diabetes mellitus, or unclassified. Next is the total number of unique high-risk ADEs. This is the total number of adverse drug events among high-risk patients. Each event counted only once. The next definition is the total number of potential ADEs among high-risk patients, with each event counted only once. Cardiac peripheral vascular diagnosis indicates the number of rows where cardiac peripheral vascular equals Y under acute conditions. Diabetes mellitus diagnosis are the rows with diabetes mellitus equals Y under acute conditions. Chronic pain diagnosis are the rows with chronic pain equals Y under chronic conditions. Unclassified diagnosis is all other rows are assigned to the unclassified category. The data source for this report is the OASIS, or Outcome and Assessment Information Set Reference, Agency Patient-Related Characteristics Tally Report, and Patient Tracking Sheet. The URLs are provided for your reference. The data time period includes all OASIS assessments between the dates indicated. Let's go to the next page. On page 2, you'll see your home health agency name at the top. Beneath that is the ADE and pADE ADE rates and OASIS assessments between the dates indicated. The columns in the table follow the definitions that have been shared. The numbers in the table are the numbers indicated by the definitions for the defined time period. Note that the patients and their associated ADEs and pADEs may be associated with more than one diagnosis type. In the rows below the table, there is the overall ADE rate for your agency per 1,000 unique screened patients and the overall pADE rate per 1,000 screened patients. There is also the overall ADE rate per 1,000 screened patients who are high risk, including those with cardiac peripheral vascular disease, chronic pain, and diabetes mellitus diagnoses. Now let's look at the next report, which is the adverse drug event and potential adverse drug event patient listing. Let's look at the definitions for the columns in the report. First, there's the patient name, the start of care or resumption of care date, whether this patient has a cardiac peripheral vascular disease diagnosis, where cardiac peripheral vascular equals Y under acute conditions, diabetes diagnosis, where rows with diabetes mellitus equals Y under acute conditions, or chronic pain diagnosis, where rows with chronic pain equals Y under chronic conditions. Other unclassified diagnosis includes all of the rows assigned to the unclassified category. Under ADE, whether or not there is an identified adverse drug event. Under pADE, whether or not there is a potential adverse drug event identified. The data source is the Outcome and Assessment OASIS Information Set, OASIS Agency Patient-Related Characteristics Tally Report, and the Patient Tracking Sheet. The URLs are included for all of these sources. The data time period includes all OASIS assessments between the identified time periods. On the following page, you will find your agency's data. Your agency's name is included with all patients' names listed from OASIS assessments between the identified time periods. The start of care or resumption of care date is listed. The appropriate diagnoses are checked, including cardiac peripheral vascular disease, diabetes, and/or chronic pain, or other unclassified diagnosis. Also included is whether or not an ADE or pADE was discovered. This concludes the explanation of the data reports. Please contact the Lake Superior Quality Innovation Network and your state contact for any questions. Thank you.